Hello, everyone, and welcome to the Power Within podcast. I'm your host, Alethia Jackson, founder of the Ultimate Power Play, an executive leadership platform and community that convenes women leaders across sectors to share bold ideas, exchange what's happening in their sectors, and what's shaping the future of industry. I'm also the founder and CEO of the Stuyvesant Group, a strategic advisory firm that helps companies and organizations navigate growth, policy, and stakeholder engagement in highly regulated and rapidly evolving industries. I launched the Ultimate Power Play because during my time as a Fortune 25 executive, I found myself searching for authentic spaces where leaders could connect across sectors, not simply to network, but to share and support one another's growth, to share ideas, and so I started the Power Play. And what began as a personal need has evolved into a powerful community of leaders committed to making a meaningful difference in their organizations, industries, and communities. At the Power Within, on this podcast, we explore something that personally fascinates me, which is the concept of power, influence, and modern leadership. Through conversations with extraordinary women leaders whose journeys and perspectives inspire me. The concept of power has fascinated me for years, largely because it's often so misunderstood. We tend to think of power as something external, attached to a title or position or a seat at the table, a recognition bestowed upon us externally. But really, power is the ability to create change. It's the capacity to influence outcomes, shape decisions, inspire actions, make an impact, and drive outcomes. And while titles and positions can amplify power, they don't create it. Real power already exists within each of us. Yet many of us never fully recognize this power and as a result, don't fully utilize it. Through these conversations, we explore what power looks like in practice and how leaders discover it, how they cultivate it, how they use it to navigate challenges, create opportunities, and drive meaningful change. Today, my guest is Tisha Boatman, Executive Vice President of External Affairs and Healthcare Access and Head of Global Government Affairs at Siemens Healthineers. Tisha leads the company's efforts to expand access to healthcare around the world, working at the intersection of innovation, public policy, and patient impact. And she's driven by a simple but powerful belief that high quality healthcare is a human right and that meaningful progress happens when public and private sectors work together to improve health outcomes. Before stepping into her current role, Tisha held a number of leadership positions across Siemens Healthineers, including portfolio management, marketing, business development, and corporate strategy. Her career has taken her around the globe with leadership assignments across Europe, Asia, including serving as managing director for the company's business in the Nordic and Baltic regions. Today, Tisha is helping shape conversations about healthcare access, early detection, public private collaborations, and how innovation can help create healthier futures for everyone, everywhere. Tisha, welcome to the Power Within. It's so wonderful to have you.
Thank you very much for having me, Alethea. It's really a joy to be here.
Well, thank you. So, we're going to hop right in. And this is the big question I ask everyone. And
Mhm.
it's how do you define power?
It's a great question. It's one I really had to think about, right? As you said beautifully in your opening, it's often something we don't recognize. I think for me, it really comes down to influencing for impact. There's a piece, for me, it's a very active topic about power, but not always in words or actions, but this combination of really motivating others to drive certain changes. I personally don't think of myself as a powerful person, but I do think of myself as somebody who strives to set the example of the person I want to be.
I love that. And so, I'm going to ask this. Again, your work spans the globe. Does power look different globally? Does it shift based on cultural norms or actions that you may take to drive change?
I don't know that it looks maybe a little bit different, but I don't know that it really does shift. So it for me it comes down to what are the behaviors. It can be spoken words, it can be actions, it can be driving for change. What are those behaviors that motivate people to move, and particularly move when there's a challenging situation, when there's a change scenario involved. So certainly in some cultures, people are more verbally expressive. They very clear about what they want. In other cultures, you need to look for, body language and other types of symbols. But at the end of the day, the topic of motivating for change and impact, I think, is similar. It might look a little bit different in different cultural contexts.
And what would you say, there's something that we all leverage, and again, that may change or evolve over time, but things that are our superpowers that do allow us to navigate and to help effectuate change and drive outcomes. What would you say your superpower is if you had to choose one?
It's a tough one, but it does come to mind for me. I am very curious, and I call myself an adventurer, really, when it comes back to like early days, when I was a teen. But I like to try new things. I like to explore new things. I have this very active piece of my brain and my body, quite frankly, that always kind of keeps me going. I'm often told I'm super high energy, and it's really my curiosity that creates that energy.
And I would think, especially in working in healthcare, how relevant that is. Because it seems that we're always trying to sort of fill a gap, solve a problem, or how can we do better to serve patients and communities? And to your point of being curious, asking the why, and always stretching, I would imagine that's incredibly important in that field. And generally, if I think about healthcare, it's quite honestly one of the most complex and highly regulated sectors in the world, but also deeply personal. When I first started working in healthcare, and I would sort of go to Capitol Hill sometimes, staffers would say, like, I am not the healthcare person, or if you are the healthcare person, you are. They own that. It's not something you dabble in, because how critically important it is to everyone. You are either all in or you're not with respect to healthcare. And so with that, I would ask, where do you believe, as we look at healthcare, and we're in such a interesting time with the use of technology and direct to consumer, hearing the patient voice more with healthcare, where do you think the real power is sitting in healthcare today? And how can leaders use that influence responsibly?
It's a tough question to answer, I have to say. I think realistically, a lot of the power in healthcare today sits with payers, which payers can be insurance companies, it can be governments, depending on the health system where it's funded. So the power in terms of what's paid for, what's reimbursed, and also how organizations are staffed with clinical staff in order to be available and accessible to patients. That core piece of power often sits pretty far from the patient. I think, we're seeing healthcare become a little bit more consumer oriented. We're seeing patients have more access to technology and information about technology through the internet, through, items like AI solutions where they can ask questions. I'd like to see patients and clinical staff have an increasing amount of power in health systems. And there certainly needs to be a little bit more balance, I would say. But the reality is a lot of power sits in what gets paid for, right? At the end of the day, healthcare is very expensive, only gets more expensive as new technologies come into play. And I think there does need to be a little bit of a shift closer to patients and to importantly, the clinical staff who are also challenged with making decisions every day on behalf of patients.
It's interesting because, again, in healthcare, there is such a broad ecosystem and so many players in that, as you just raised. There's the patient, there's the provider, there's the payer, and a host of others, in between. And often one of the issues, at least in my opinion, what I've seen is connecting all of those dots, because often people are operating, or sectors are operating in their own silos. But how do you, really connect that, and even really build that community of care around that patient to drive greater connectivity? At Power Play, we talk about community often, and the importance of having that, and whether that's to support the work that we are doing to support people personally, or to, in this space, just kind of support the system that's driving, delivering care, and developing, care and services to serve the patients. I would with that, ask you how important is community in the work that you do?
Yeah, when I look at community, for me, it comes down to this topic of, who's in the room when we're making decisions and who's in the room when we're shaping systems or shaping clinical pathways. So I would say the broad community is a very important topic. And I do believe that leaders shaping health systems are getting better at this, right? Are realizing that not only, we need to look at see who's in the room, who has a voice, and are we really considering the different voices across the system? But there's still work to be done, and it's a topic. I was recently in Kenya at a conference, right, and there were multiple people who brought up, "Hey, when I look around this room, we might be in Africa." And it was the first time this particular conference was held in Africa. We might be in Africa, but are we really listening to the African voices? And in many of the panels we were, but some we weren't, right? So it's this interesting discussion about looking at the community and the people that are involved in shaping these systems and shaping health pathways. At the end of the day, a single patient is usually the person in focus that we're treating, but there's a whole ecosystem around that of different voices that need to be brought in.
Absolutely. It was one of the things I saw us do better, probably starting with COVID when we had to. I was at that time working for a large company, providers, pharmacists, and what I saw was, for one of the first times in me personally, seeing us being reached out to further than within that community, but across health systems, across um, clinical providers, and across a host of others that were, again, all trying to drive some better outcomes for patients. And it was the removing of some of those, I think, barriers in the ecosystem, again, that keep us in our silos. And to your point of continuing to have those at the table, and then also critically important, that patient voice as well. We can often try and shape a solution, but it may not reflect the real realities of what is driving care or what's driving how someone is utilizing care, if we don't have that voice at the table.
It's interesting that you say that because, during COVID, I was in Denmark. I was living in Copenhagen, Denmark. I found a lump in my breast. I was responsible for our business and the Danish in Denmark and the Nordic countries, but I found a lump in my breast and I was also going through breast cancer treatment. And maybe we talk about that a little bit later on. But I did absolutely find that although I couldn't travel for multiple reasons, I wasn't flying to Finland to visit my customers and my team there, so I couldn't travel both because of COVID, but also because I was having medical treatment. I did find that I was able to connect deeper in my organization. And that started really with my organization because normally I would not have sort of employee roundtables unless I was physically in a geography. But now we could do all of that virtually, right? We really did have coffee hours and even Friday happy hour, virtually. I had some really creative people in the communications team that were eager to bring in these different ideas and technologies. But it also happened with customers, right? I remember the first time I had a customer kind of steering board virtually, the customer, quite frankly, was quite uncomfortable with it, right? That we weren't physically in the same room. But we talked about that the probably the only person that was truly missing from the virtual conference was the patient. And it was just an interesting perspective, but it requires it caused us to stop and think a little bit about things that we wouldn't necessarily have considered in the past, which is one thing we absolutely have to appreciate, at least coming out of COVID. The topic of being able to use digital technologies to engage more really on a human level with people is one of the best things coming out of that.
I would absolutely agree. There were times prior to COVID where if I couldn't get to company's headquarters, I was not in that meeting. And,
Mm.
or we were using a really shaky conference phone line that I really wasn't in the meeting. No one
Yeah.
could see. I couldn't hear them. It was terrible technology. And we jumped into COVID, sort of were forced into that space. And suddenly it was critically important that one, everyone was in the meeting across the enterprise, because we all were helping to guide the company at this really critical moment, in trying to serve patients and customers. But we also, with that being the case, there was probably no meeting we weren't all in. But then it also allowed us to connect. It was one of the things as I would have calls with my team before we ever got to the business of the business. The most critically important thing was how are you doing? In this moment. And so it did remove some of that, and it really sort of humanized us. And if we didn't know each other personally, previously or as personally as we, could have, we definitely saw each other in our most human way during that time.
Yeah, for sure.
So, you did touch on, I think this is important. I do want to ask you about this, your medical challenge that you suffered during this that put you in the position of being the patient. And so, we'd love to just tap on that experience and how that plays into even, the work that you do today and your perspective on that, as well as the resilience that I'm sure.
Yeah. Well, I mean, in March of 2020, so right at the beginning of the COVID pandemic, in the country of Denmark, we had just shut down, right? We had just gone to home working and closed down. I found a lump in my breast in a self exam. I was 45 years old. In Denmark, that's too early for a mammogram because I did not have a family history, nor did I have the genetics. So I was checking, thankfully, because a good friend of mine and had told me that she found her own cancer and that she had always checked. So I found this lump and I ignored it for a couple of days, and then I checked again and it was still there. And no matter which way I pushed on it, it didn't hurt, but it also didn't go away. So some people often say, "Well, I'll never know if I find something," so that's why I don't check. Well, it felt like a pea-sized hard lump, and it just was odd. When I looked into that, when I went to Doctor Google, as we often
Very
do,
Doctor.
um, I went to Doctor Google, and Doctor Google said a pea-sized lump in the breast that doesn't hurt is not a good sign,
Mm,
and it could be cancer. So I immediately contacted my primary care physician, and without seeing it, I contacted him on the phone. He said, "I'm going to send you for a mammogram because you obviously have something that should be checked." So it turned out to be stage 2 cancer. I was really glad I was checking because it was deep enough in my breast that there were no surface signs, and like I said, there was no pain. So had I not been checking, it probably would have been stage 3 or 4 before I noticed it, right? At some point, it would have grown to a larger cancer, and there probably would have been some surface puckering, probably still not pain. And that's one of the things that people don't understand is that a lot of time breast cancer, there is no pain associated with it. I had no pain associated with my therapy until I got to the point of having a mastectomy, and I ultimately did have to have chemotherapy, a lumpectomy, a mastectomy because additional cancer was found, and radiation therapy. I'm 6 years plus cancer free today. But the main thing I want to talk about here is just this importance of speaking up when something's not normal for you, right? As a patient in the health system, whether you're given agency or voice or not, it's super important. Nobody knows your body like you do. And unfortunately, us as women tend to be making, well, the data shows women make 75% of the health decisions in typical families. They send the kids, take the kids to get their vaccines. They ensure maybe their spouse or significant other is taking all of their medical checks, but very often women ignore themselves and don't take action for themselves. And nobody knows your body more than you do. So obviously super happy that I listened to a friend of mine and was doing my self checks and did find a stage 2 cancer. Now, what did that do to me? I would say, at the time I had 2 jobs. I was CEO of a country organization for my company, health tech company, and I was also CEO and managing director of a multi-geography, so across the Nordic and Baltic zone. I gave up some of my responsibilities. I delegated those and to others, and I kept some of the responsibilities because I was able to work and wanted to be able to use my brain in that way. Um, and ultimately, when I was fully well and ready to come back to work, I didn't end up taking most of those responsibilities back. And it felt very empowering to me because had a realization that, the individuals who were leading those activities were doing a great job. that they might see it as, unfortunate that I would take that responsibility away from them, that they had learned, that they had challenged themselves to take on. And I could utilize my time to grow and build additional leaders in my organization. I could spread, my impact in a different way going forward. So I made a conscious decision not to come back into most of what I had given up and use my time in a different way, which was great. I really felt 100% back, but also 100% having grown personally and professionally through that 10-month cancer journey.
Wow. It's interesting because it affects you, personally, professionally. It's, as I mentioned, healthcare is one of those things that are, again, incredibly personal. When I first started my career, I was at a lunch with Fran Drescher, and she mentioned that she was diagnosed before she got her diagnosis for cancer, and I believe it was cervical cancer. And she didn't present. She was too young. She was like, her weight wasn't where someone would normally. It was all of the indicators that she did not present as someone who would have this cancer, but she knew something was wrong. And she continued to lean into that, continued to see specialists, get second opinions, have others look at her x rays. And to your point, one of the most important things is your body better than anyone. And when something is not right with it, exercising that agency to speak up, and not let it be put on the back burner or ignored, because it does make all of the difference. And so I didn't want to move on with us without just kind of seconding you on that. In 2021, I had a health incident, and I was fine prior to that. Just moving around the country, doing, again, it was during COVID and vaccines, and I felt terrible. I thought I had the flu, or maybe I had COVID. That was not the case. Turned out to be something much more serious, but I continued to be told, "No, I think you just have a virus. No, I think you should go home and do X." And having to continue to say something is very wrong, and we need to look at this. And again, I we did, thank God, I was able to get great treatment, but it was a process. Similar to you, I was out of work for a period of months and went through a lot of medical treatments, but just speaking up, exercising the agency. And I also have to say it's one of those, and I was very lucky. I had a great medical team, but also when you think about healthcare, you also think it ultimately runs on trust too, being able to trust those who are caring, trusting your instincts, trusting your body, being able to trust those who are caring for you. And so that, which leads me to my next question. Again, healthcare runs on trust, and that's between patients, providers, institutions, communities, public private partnerships, which you talk about a lot. I've done a lot of public private partnerships and during the course of my career, and that trust is especially critical there as well. How do you build and sustain trust across healthcare and the work that you're doing, especially in moments when confidence in institutions and leaders is fragile?
Yeah. I would say I'll take the question from two angles. One is when we're starting a new project that I'm involved in, that I'm one of the leaders of, and then also individually. From a project standpoint, because we do talk a lot about public-private partnerships, the complexity of health systems, there's a lot of different players that usually need to be involved. So I think it's really important from the beginning to be super transparent and openly communicate not only about the goals and intended outcomes of the project, but also about the values, right? We tend to think, well, we're all working in healthcare and health tech, so we have shared values. And there are certainly some natural overlaps. But until you really sit down with a new entity that you're working with or a new person and really discuss, what about your values is really important here. And some organizations will tell you, hey, for us, it's really important that we have certain impact outcomes. Okay, great. It's really important to us that all the voices in our organization are heard. I remember a project we did one time in the Nordics with the neuro department at a major hospital, and they said, for us, our neuro nurses are one of the most important voices in this project because it's a tough job to be a nurse who is monitoring a patient that is generally, in a coma and not able to speak for themselves. And those are jobs we have tremendous turnover of for. So one of our goals of this project is to reduce the stress of our nursing staff, right? Which is not something that I would have naturally thought about going into that project, right? So this transparency on what are your values, what are your goals and outcomes. And I think it's, for me, it's very true individually. I mean, trust is super important to me. It's very rare that I would have a situation where I really feel like I can no longer trust someone. But vocalizing that from the beginning and, what are your core values? What's important to you in this piece? I think sometimes that comes a little bit naturally as you build a relationship. But if you're forced to kind of very quickly get to a trusting situation with somebody, I think it's important, at least for me personally. I'm often told I'm an open book. And I try to also elicit that from others to understand and read from them if they don't want to talk about it openly, what's really important and what they value.
And it's a great point. I think also when you touch on that sort of transparency, and especially when you are building partnerships, one of the things I've also found is being honest, not only about sort of what you value, but what I bring, right? What the organization brings, what are our strengths. And it's not, it's rarely going to be everything. Here's the sweet spot. Here's where we have this kind of expertise, this position to win, and where we can partner, not overselling, but being very honest on that. So the expectations are there with that trust because someone is entrusting you with the thing that they value and that they are trying to accomplish. And so what is that gap that you are, able to fill? And that's the space. And so sort of being very honest and transparent about that as well.
Yeah, and maybe also those mechanisms. What are you going to do when something goes wrong? This has actually come up recently in a discussion I was having around partnerships. I mean, if you have a complex topic that you're working with somebody on, whether it's a one-to-one basis or a large, multi-sectoral partnership, and it's going to go, I mean, there are going to be things that don't go right. So what are we going to do when that happens, right? Pulling out the contract is not going to solve the problem. Right? So do we have a mechanism? Have we agreed how we handle it when something gets a bit off track? I think can be extremely valuable.
Yes. And, the goal of most of these partnerships, right, is that you are able to have a long term sustainable partnership. So, having what's the transparency, what's the accountability as things go wrong, and how do we, what is our agreement on how do we work to fix those are important. I want to ask you a couple of questions, and your career has been so interesting, and you've played so many roles. And when we first met and talked, you told me about the various roles you played across the company. When, how do you know when it's time to sort of evolve or pivot or reinvent yourself, if that's how you view
Mm,
those changes?
mm. I think for me, I am a very curious person and a very active person. I'm kind of always moving and always kind of looking at something new and thinking. I usually take time. Most Fridays, I spend an hour or two reading something or looking, set aside a little video that I really wanted to get to, and then I'll come back to it like on a Friday. Um, and I think at different points in my career, I've been very curious about something outside of my current scope, right? And I always have felt encouraged and enabled, allowed, if that's the right word, to, reach beyond my current scope. One of the things I tell junior leaders is keep your eyes open and, of course, make sure your own area is straight first. But always kind of look around and see where else you can make an impact, where else you can contribute, where else you can bring in a different viewpoint. But there's just been different points in my career where I sort of say, I've had the impact I can here, and I'm interested to do something else. I mean, I mentioned before that I was heading up the Nordic countries and Denmark, and that was a great role, an absolutely great role. I've had a lot of great roles where I always think that's the best one, right? But at some point, I was asked, "Would you be interested in supporting our business development and our active effort to expand access in low and middle income countries. And maybe I want the most obvious choice for that. I was an American, having living and working in Denmark, one of the best, most funded, well-funded health systems in the world. So why would I be the one someone might think would want to lead work for low and middle income countries? But it was a lot of it was about curiosity, and I had said multiple times over the years to different leaders in our organization, I'm not super interested to maybe go work for the WHO or working, but if we ever were going to advance our work in these and some of these under resourced or under resourced environments, I would love to be part of that. So I was asked, but I was asked based upon curiosity that I had expressed in the past, right? And I think that is usually what happens is I am kind of looking into a new area, I'm thinking about it, and an opportunity presents itself, or I create an opportunity that moves me into the next area, sort of leveraging what I know, but pushing myself, right? Because I do love to learn and I love to explore new things.
Have you ever felt that making that ask or that it was risky? Or have you always felt comfortable in doing that or making that change? Or
Oof. No, I still get pretty bad what we call imposter syndrome, right? Like, am I really the right person? Am I making the right moves? What did I get myself into here? I I I definitely I find if I'm not pushing a little bit in that direction, then I'm too comfortable. I do like to be a little bit outside my comfort zone. So certainly I have found, some of that risky. I've had people say to me things like, well, you had a great role where you could hit all your numbers and you could absolutely demonstrate success year after year. This is going to put you into difficult waters. When I made that particular move I was just speaking about, there was a lot of ambiguity. What are exactly are the targets we're going to achieve, and do those align with how different leaders in the organization see it? But the piece of ambiguity actually also is part of what energized me. That this is not a clear and known responsibility. I'm going to have to define that a little bit, and I'm going to have to find leaders to come with me on this journey, which was great. That was probably the funnest part of it, was creating this coalition within the organization and hiring in some great staff to get that done.
I love that. And I ask about risky. I've had that encounter once, and I was doing incredibly well. I'm hitting all my targets, and I had a leader leave, and I would have been the sort of next successor for that role, it seems. And I had to have a conversation with one of our executive leaders to say, actually, I don't want to go out for that role. I enjoyed this. Feel like I've done in sort of all that I can do here, done great work here, but I actually am curious about something else and would like to move in this other direction. And it's that sort of calculated risk of like, okay, well, this is sort of your natural thing, but you are saying you would like to, again, lean into another area. I was lucky it was well received. And the question was like, well, what are the two things you would like to do? And, okay, well, let's think about that. And time later, I ended up being asked to take on another role, which was completely different from what I had been doing within the company. But it also felt like the right next step because of the curiosity, because I just thought like there's great work somewhere else within the organization that I could be doing. But I felt like I'm definitely taking a risk by asking this.
And how empowering a question for you, right? Where is it that you see your impact, right? To just to ask somebody that and have them really have a chance to think about and answer that is it can be an accelerator for folks, really.
Yeah. So, share with me a habit, a discipline, a resource that helps you really tap into your superpower, that helps you operate at your highest level, that re energizes you.
Hmm. I'm really big on refueling myself, or what I call recharging myself. Um And there's really two ways I do that. One of them is I'm a big one for physical fitness, and I'm not talking about doing triathlons here. I've never done one in my life, and I don't know that I could complete it. Um, but I love to get in some fitness, particularly outside if I can. You know, it wouldn't be unusual to see me buy snowshoes like I did this winter because I had had just about enough of the gym in Philadelphia where I live, and we had a long, snowy winter. But I like to get some physical fitness, and I really do just focus on enjoying myself, and it's so good for my mental health, right? I mean, that's really it kind of clears my brain. A great, kind of hike would be for me would be I maybe start out thinking about a few things, but by the time I get back, I'm just thinking, "Ooh, that was really nice. I got a couple of nice pictures along the way. That was beautiful." Um, so for me, this getting some physical fitness, and I put it in my calendar. I mean, a lot of executives do, right? It is one of these things, but I put it in my calendar. I don't try to hide it. I am very open. I need my fitness this afternoon. I started out at 6 a.m. today. At 4 p.m., I am shutting down and I'm getting some fitness in because I need that. That's my recharge. The other thing is this thing I talked about where I do like to kind of read, listen, engage with different things. And I try to also put that in my calendar. So very often that's on a Friday when it's a little quieter. I work in the Eastern time zone, and a lot of my counterparts are in Europe or in Asia. So by Friday afternoon, they're on their weekend, and I can have, and I do collect things in a certain folder that I'll go and look at, read, and that is super motivating for me. And sometimes it's just, it goes in and it goes into that background material. But a lot of times it creates some sort of little action for me, where I say, next week I'm going to ask so and so about that, or I'm going to look into this. And, that conference that I said I wasn't going to attend, this brain health stuff is really interesting to me. Maybe I'll see if I can make that fit in my plans in the future. So it's a bit of a recharge, a little bit more professionally focused, I would say. But sometimes they're very personal things as well. Shoot, I don't know why I committed to doing that on my daughter's graduation. We're going to have to spend some time reorienting the calendar because I'm making it to her graduation.
Absolutely. You're in trouble if you don't.
That's middle school, right? So there was a brief moment where I was like, "Do I have to go to the middle school graduation? Of course I do. What am
Yes. It is the biggest thing for her. No, for
Yeah,
sure.
for sure. Yeah.
Tisha, what are you most proud of?
I would say my two gorgeous teen daughters who are just superstars, really good humans, right? They've been raised across three continents, right? They both moved to Denmark before the age of 5, and went. They're only in U.S. schools for the last 2 years, so they entered U.S. schools in seventh grade and sophomore in high school, right? Which sounds pretty tough, U.S. public school, but they both transitioned amazingly. And I would also say, I've mentored a lot of people over the years. I tend to mentor somewhere between 5, 6, 7 people at a time. Sometimes they're assigned through company programs. Sometimes they're people who've just reached out and asked, usually a mix. And most of those mentees I still keep in touch with, right? I learned a lot from them, and in a reverse mentoring informal kind of way, but I also just love to watch them grow, right? And learn from the choices they made. I remember one mentee in particular, who still works at Siemens Healthineers. She said something to me like, "Yeah, I'm going to ask my manager for this and this concessions around my role." And my first thought really was, "Are you crazy? You just got a really great job, and now you're going to ask for all these special considerations? You should just go for it 100%." And so I challenged her a little bit on it. And she said, "Yeah, but I can't be my best self if I don't, do this." One of them was moving and working remotely. So accepting an office based role and then saying within 3 months, "Nope, I'm going to move because that fits better for me." But I still want this cool job that I had to fight for competitively. And you know what? She got everything she asked for. She sat down with her manager. She discussed it. She had her good reasons. She got everything she asked for. And when I spoke to her later, I said, "What if you hadn't gotten that?" She said, "Well, that would have been okay, but I would have known that I spoke up for what was important for me." What an amazing lesson for me at that point in my career. But yeah, there's some great folks, some still in the company, some have moved on. But that is, I think, a big part of what my legacy can be.
Wow. And that leads me so naturally into my next question, which is what is the power you hope to leave behind and what is that legacy?
Yeah. For me, it is this topic of expanding the impact that we can have as an organization. So, demonstrating personally as a leader, but also motivating others. The company I work for, we are innovation leaders, over 100 years old. But really, we are working hard to what we call do breakthroughs for everyone, everywhere, sustainably, and that everyone everywhere is not easy, right? It is not easy when you look at low resource environments and what kind of innovation is necessary in some of these low resource environments. It's not easy when you look at certain topics. One of the topics I spend the most time on right now is women's health. And the fact that women live a large portion of their lives not in good health. So often people say, well, women on average live longer than men. They do, yes, but, unfortunately, a woman today who's in her 90s may have spent 20 to 30 years not in good health, not in as good health as she could have. So these topics, that are not easy, that are super nuanced, that require leadership, and they require a lot of curiosity, but also a lot of courage. Those are the kind of topics that I enjoy spending my time on, and my legacy I would love to leave is inspiring others to do that, to take whatever it is that is challenging and difficult, but they believe in it and really drive it forward. I think is probably the best legacy I could leave. But I got a long ways to go, by the way. I'm going
Like,
anywhere.
I'm not leaving any legacy
I'm
yet.
not leaving
I'm
anytime soon.
still around and kicking. Okay.
Yeah.
Well, thank you. And, I think honestly, you are probably leaving a little bit of legacy every day and everyone you're touching. I remember, some of the best mentors formally and informally that have moved through my career and they've left a little something, even though they're still here with me each time. So I would say you're doing that every day. And so thank you. Thank you so much for this incredible conversation. It's been inspiring to learn about your journey, your resilience, and the way you embrace power. And so, thank you for joining us. For everyone who's listening, please make sure to follow us on the Ultimate Power Play on LinkedIn, on Instagram, and follow the Power Within podcast. You can find us on Apple Podcasts, Spotify, as well as YouTube. Tisha, thank you so much.
Thank you so much. I've really enjoyed it. It was wonderful to speak with you and also to just think about these topics, right? How often do we take the time to really think about topics like this? So thank you for creating this forum.